Life with Tuesday Tips. This is our weekly check-in. We go over different topics in plastic surgery, and I get to answer questions. And today's topic is one that I've been getting a bunch of questions, so I decided to just do a live about them. It's the new implant in the block, Motiva Implants. So this company is new to the US, but it's not new worldwide. So I want to talk a little bit about the implants. We have it here available at Pure. So I've had a few patients ask me about them. So we'll talk about their technology and their differences or their unique abilities or characteristics of the implant. And I'll get to answer questions, okay? So Motiva, like I mentioned, is a new company in the United States. It's FDA approved for silicone implants for aesthetic and reconstructive purposes as of September of last year. But it has been in the market in Europe for the last 14 years. So even though it's new here, it is a company that has proven their safety and their rates that I'll talk a little bit about in a bit for years now. So that's one of the main reasons I decided to offer it here in my practice and here at Pure, because of its safety background and the record that they have for the past 14 years, which matches the statistics that they've done here in the United States with the studies that need to be taking place in order to be FDA approved, okay? So what are the differences of this implants with prior implants that we had here and that we still have here in the United States? One is the silicone itself. So silicone gels for implants have been used for many, many years, and in the 90s they were actually banned from the United States to use silicone because of some safety concerns. There were a lot of studies done for making this device safe in the early 2000s, and that's when in the 2000s when it came back in the market. And the silicones that we have available in other companies here in the United States is what they call the 5th generation or gummy bear implants. So Motiva is actually a 6th generation implant, which the viscous, elastic properties are a little bit, let's say, thicker, so you understand it, and they integrate better with the gel, so they feel a little bit more natural. That's what the company and the technology feels like. So that's the other main difference is not all the implants are 100% filled, which means that the risk of having rippling or having friction of the shell increases. When you have a silicone that is 100% filled, then the rippling is less, the friction is less, so the rupture rate is less, okay? So this gel type or this cohesivity allows for the implant to be fully filled without the need to become hard. So it's soft to the touch, but 100% filled, which makes it less risky to have rippling or irregularities when you fill your implant, okay? The other characteristic that is very characteristic is what they call a true monoblock gel. So usually implants are made the shell or the covering of the implant and then filled with the gel. This one is completely integrated, so you can't really differentiate or try to squeeze out the gel and have just capsule because it is completely integrated both. Why do we need that? Because less rippling, less ability of folding and friction of the implant, less rupture rates, okay? So all of these things translate in what I'm going to be talking about at the end, okay? The other characteristic or difference between this type of implant is its surface, okay? The surface of the implant, and this is something that we've talked about a lot, especially with textured and smooth implants. So in the past, we had two classifications of surface implants. We have smooth implants, which is the ones that we use here in the United States, and we have textured implants, which were taken off the market because of the risk of developing lymphoma, breast implant-associated anaplastic large cell lymphoma, and also squamous cell carcinoma. Those textured implants, which is a very rough surface, were eliminated from the market here in the United States. But this one is what's called a smooth silk. So when they look at it in the microscope and kind of like zoomed in at the surface of the implant, the smooth has 0 microns Textured implants had 70, 80 microns. This has only 4 microns. And why is that important? Because it gives just a little bit to create a similarity with our own tissue. Our own tissue is not completely smooth, and the response of our immune system to the implant is less, which means less inflammatory response, less friction, like I mentioned, because of the true monoblock and the viscoelastic properties of the gel, and because it's 100% filled, and because it has less of all of this, less bacterial attachment. What does that translate in? It has the lowest rate of capsular contracture, only 0.5%, and lowest rate of rupture, only 0.6%, okay? And that's the difference of this type of implant with prior implants that we have here, okay? The other difference is in the very similarity with other implants is the types of gel and its profile. So let's talk a little bit about the gel types. With other brands, we also have different cohesivities of gel, which means there are gels that are softer, feel more natural, but keep their shape less, or change more in position once they're in your body, or gels that are more cohesive, they're thicker, they keep their shape more, but then they feel less natural. Basically, Motiva here in the United States has 2 types of gel available. We have what they call the ergonomics gel. The ergonomics gel is designed to behave like breast tissue in the sense that the tissue is gonna, or the gel is gonna move with gravity as breast tissue does, okay? So it feels very natural and close to breast tissue. And they have a little bit more stable gel, which is the smooth silk gel, which then keeps its shape more and it does not behave as breast tissue with gravity, so the shape keeps more. This is gonna give you a more augmented look, push-up bra look, and the ergonomics is gonna give you a little, still shape, still volume, but more natural when you're standing up rather than the one that keeps its shape with gravity, okay? So you can see here the differences between the smooth silk and the ergonomics gel in Motiva, okay? And like similar to other brands, we have different profiles. So profile means how round the implant is. Similar with a low profile, it's going to give you a very subtle augmentation. A moderate profile, more augmentation, it's rounder, but not that push-up bra look, very round. And we have the full profile that it's like very round implant. So they have different names, but the same concept. They call mini, they call demi, the moderate, and full for the full or high profile implant, okay? So still differences or still options to choose from different profiles and still options to choose from the different gels. All of it, 6th generation, viscoelastic properties, and the true monoblock gel. So this is Motiva. I do think they're safe, they're great to have a new implant. I always think that it's great to have more options. Not everything or everyone will feel that one certain implant type is best for them. So having more options, I think it's always great. I don't think that everybody should get Motiva implants. I think that you should consider your options and then make an informed decision. But I just wanted to basically explain this type of implant because it's new. They're still newer in the United States, so that is something to take into consideration when you are evaluating this type of implant. Other companies have been in the United States for years, so they have a track record, more documented and more available in the literature. So all of those things are important to consider. It's a very personal decision what you decide to put in your body. So I always think that having options is great. I'll take some questions now if you guys have them.
Somebody said, thank you, Dr. Vidal, for giving us education. I love watching your YouTube videos.
Awesome. You're welcome. I'm glad that it's helpful.
As of right now,
a lot of thank yous.
You're welcome. You're welcome. So yeah, we have available here at Pure Allergan Natural implants, which are the ones that I've been using for years. They're great implants. And also now we have Motiva. So like I mentioned, I don't think one implant is better than the other. I think there are characteristics and unique properties of each implant for each patient. So if you want to know a little bit more about your particular case, it is something that you can bring up in your consultation, that you want to know a little bit more about both. We have samples here in the office for both, so you can feel how Natalia feels like, you can feel how Motiva feels like. Another thing that I didn't mention is that Motiva implants are a little bit rounder, and you can see the edges of the implant, and Natalia is a little bit flatter, and Motiva it's a little bit curvier, which translates in more projection even in the lower profile implants. So something to consider if you want a more natural look. I will be visiting their manufacturing in Costa Rica next month, so I'm very excited to learn more about their products, in where the implants are made, and learn more about the safety profiles. And I'll be also learning in the operating room with a surgeon there to be using it in a patient. So very excited about that opportunity. I'll keep you guys posted.
Two questions.
Yes.
So one of them, do you do implant removals? And if I'm from Puerto Rico, how do you deal with somebody out of state?
Muy buena pregunta. Yo soy de Puerto Rico, así que tengo muchas pacientes que viajan, no solamente de la isla, pero de otros estados que viven, así que sí, es una posibilidad. Tengo muchísimos pacientes que viajan, tenemos un protocolo bien establecido para pacientes que no son de Miami. Para operarse sí hago remoción de implantes, puede ser remoción de implantes con levantamiento, puede ser remoción de implantes con transferencia de grasa, puede ser remoción y cambio de implantes si ese es el caso, así que pues tendría que evaluar tu caso, pero definitivamente se puede hacer. So I just told in Spanish that I do all of those surgeries, implant removal with or without a lift, implant removal without a lift and or fat transfer, and also implant exchange depending on the patient goals and their anatomy. And I do a lot of out-of-state patients, so we have protocols in place for patients that are traveling, and also recommendations to where to stay if you need help, aftercare, massages, and all that.
Perfecto. La consulta será
presencial. I'm helping you.
Yeah. ¿Existe alguna alternative virtual?
Sí, muy bien. So, sí, si no estás en Miami, la opción es virtual, pero si quieres viajar, tengo pacientes que desean viajar porque desean conocer la clínica y conocerme en persona antes, también es una opción que vengas antes para la consulta presencial. Si vives en Miami, puedo hacer consulta presencial también. Lo que sí yo pido es que me llenen el formulario antes para evaluar tu caso. Con esa evaluación yo te puedo decir un poquito más de información en cuanto a la consulta, y entonces la hacemos presencial o virtual, lo que tú prefieras, para evaluar tu caso antes de la cirugía.
Another question.
Yes.
When can we spray tan after a surgery, specifically brachioplasty?
Very good question. So spray tanning or tanning, I would recommend to wait at least 3 months, okay? In that initial period, the scar's still forming, and some of those particles can get into the scarring and can become permanent. So it's better to wait, have everything healed, and then you can spray tan, and everything like that.
Oh, somebody's question was, can spray tanning stay in the scars? You just answered that.
Yeah. Unfortunately, yes.
And she goes, oh, thank you for communicating all of that with me.
Of course, you're welcome. You're welcome. Our website has a link on virtual consultation. That's the easiest way to contact us. It's a form that you put in your information, and then a person from our team will give you a call and will explain to you the process of consultation, which is very easy. Okay. Awesome, you guys. So I hope everybody learned a little bit about the new implants on the block, and when you start seeing stories and videos, you know a little bit about what the background is. So FDA approved, safe implants, another option to have on breast augmentations and breast lift implants. So the other thing that they have running right now is a Meghan Trainor campaign. So Meghan Trainor, the artist, just had surgery and had Motiva implants placed. So there is some benefits and some discounts if you are having Motiva implants and are using her story and her code for, I think it's just this month. So take advantage of that if you are considering doing surgery, okay? Thank you guys. 2 announcements. One is that I still have very, very few spots available for my free consult day. We just rebranded our aesthetic side. It's called Simple Aesthetics. And for this rebrand, I opened a free consult day. I'm going to be doing free consults not only on facial evaluation and balancing, but also surgery consults, and that's on Friday, April 4. It's very limited spots. I'm almost entirely booked the whole day doing consults, so pray for me that day. I'm loving it. But if you are interested, give us a call so you can take advantage of that. And the other one is I'm going this weekend for the biggest aesthetic plastic surgery meeting of the United States. So I'll keep you guys posted on Aesthetic the Meet. That I'm hopeful that I'm going to learn more about implants and about everything that's out there. So keep in touch, send me your questions, and I'll see you guys next week on Tuesday Tips.